In this video, we'll talk about what the ketogenic diet is. The keto diet is a low-carbohydrate diet, but it differs from other low-carb diets, such as paleo, in that it deliberately manipulates the ratios of carbs, fats, and protein to change fat into the body's primary source of fuel. Our bodies are used to turning carbohydrates into insulin to use as fuel. That means the extra fat is stored and keeps adding on the pounds. The ketogenic diet uses fats for fuel, which means it gets used instead of stored. Thus, weight loss becomes easy. In addition to weight loss, the ketogenic diet is known as the healing diet. The lack of sugar intake has been proven to help and prevent many diseases, from heart disease, high blood pressure, cancers, epilepsy, and many symptoms of aging. The manipulation of carbs, fats, and proteins is called ketosis. It's a state when the body, deprived of the usual carbohydrates and sugar, is forced to use fat as its primary fuel. Of course, turning insulin into fat also means lowering the amount of insulin in your body. That's why the keto diet has been so successful in helping people deal with diabetes. It adjusts the sugar level naturally. The ratio of carbs, fats, and protein can vary. Many people allow themselves up to 50 grams of carbohydrates a day and still lose weight. On a stricter regime, the carb intake can be between 15 and 20 grams daily. The less carbs, the quicker the weight loss, but the diet is very flexible. On the keto diet, you don't count calories, you count carbohydrates and adjust the intake of carbs versus fat and protein. A typical keto diet will get 60% of its calories from fat, 15 to 25% of calories from protein, and 25% of calories from carbohydrates. The only limitation on the diet is sugar, which you need to avoid. The ketogenic diet is not a fad. Many scientific studies have shown the benefits and healing effects of ketosis. Discuss the ketogenic diet with your doctor if you're interested in consuming less sugar, losing weight, or preventing diseases from occurring. In this video, we'll talk about the benefits of the keto diet. Weight loss and higher energy levels are only a side effect of the keto diet, a kind of bonus. As a matter of fact, it's been scientifically proven that a low-carbohydrate diet is the fastest and easiest way to lose weight, but the keto diet has many additional medical benefits. Let's begin by stating that a high-carbohydrate diet with its many processed ingredients and sugars has absolutely no health benefits. These are merely empty calories, and most processed foods ultimately serve only to rob your body of the nutrients it needs to remain healthy. Here's a list of actual benefits for lowering your carbohydrates and eating fats that convert to energy. Control of blood sugar. Keeping blood sugar at a low level is critical to manage and prevent diabetes. The keto diet has been proven to be extremely effective in preventing symptoms of diabetes. Many people suffering from diabetes are also overweight. That makes an easy weight loss regime a natural, but the keto diet does more. Carbohydrates get converted to sugar, which for diabetics can result in a sugar spike. A diet low in carbohydrates prevents these spikes and allows more control over blood sugar levels. Mental focus. The keto diet is based on protein, fats, and low carbohydrates. As we've discussed, this forces fat to become the primary source of energy. This is not the normal Western diet, which can be quite deficient in nutrients, particularly fatty acids, which are needed for proper brain function. When people suffer from cognitive diseases such as Alzheimer's, the brain isn't using enough glucose, thus becomes lacking in energy, and the brain has difficulty functioning at a high level. The keto diet provides an additional energy source for the brain. A study by the American Diabetes Association found that type 1 diabetics improved their brain function after eating coconut oil, which we'll see is an important part of the keto diet. That same study indicated that people who suffer from Alzheimer's may experience improved memory capacity on a keto diet. Those with Alzheimer's have seen improved memory scores that might correlate with the amount of ketone levels present. What does this study mean to the average person? With the emphasis on fatty acids such as omega-3 and omega-6 found in seafood, the keto diet is likely to fuel the brain with additional nutrients to help achieve a healthier mental state. The brain tissue is made up largely of fatty acids. You've heard fish referred to as brain food, and the increased consumption of those fatty acids will logically lead to improved brain health. Our body does not produce fatty acids on its own. We can only obtain it through our diet, and the keto diet is rich in fatty acids. A diet high in carbohydrates can lead to a foggy brain where you have difficulty in focusing. Focusing becomes easier with the increased energy provided by the keto diet. In fact, many people who have no need or desire to lose weight use the keto diet to improve and enhance brain functions. Increased energy. It's not unusual and has become almost normal to feel tired and drained at the end of a day as a result of a poor carbohydrate-laden diet. Fat is a more efficient source of energy, leaving you feeling more vitalized than you would on a sugar rush. Acne. While most of the benefits of a keto diet are well documented, one benefit catches some people by surprise: better skin and less acne. Acne is fairly common. 90% of teens suffer from it, and many adults do as well. While it was always thought that acne was at least exacerbated by poor diet, controlled research is still being conducted. However, many people on the keto diet have reported clearer skin. There may be a logical reason. A 1972 study found that high levels of insulin can cause the eruption of acne. Since a keto diet keeps insulin at a low and healthy level, it may very well affect skin health. In addition, acne thrives on inflammation. The ketogenic diet eases and reduces inflammation, thus enabling the body to decrease acne eruptions. Fatty acids, which are found in abundance in fish, are known as anti-inflammatory. While research is still being done, it seems likely that a keto diet has beneficial effects for a clearer, healthier, and more glowing skin. Keto and anti-aging. Many diseases are a natural result of the aging process. While there have not been studies done on humans, studies on mice have shown brain cell improvement on a keto diet. Several studies have shown a positive effect of the keto diet on patients with Alzheimer's disease. What we do know is that a diet filled with good nutrients and antioxidants, low in sugar, high in protein and healthy fats, while low in carbohydrates, enhances our overall health. It protects us from the toxins of a poor diet. There's also research indicating that using fatty acids for fuel instead of sugar may slow down the aging process, possibly because of the negative effects that sugar has on our overall well-being. In addition, the simple act of eating less and consuming fewer calories is a matter of basic health, as it prevents obesity and its inherent side effects. So far, studies have been limited. However, considering the powerful positive effects of the ketogenic diet on our health, it's logical to assume this diet will help us grow older in a more natural way while delaying the natural effect of aging. A normal Western diet laden with sugars and processed foods are certainly detrimental to warding off the signs of aging. Keto and hunger. One of the major reasons diets fail is hunger. People who diet feel hungry and deprived and simply give up. A low-carbohydrate diet naturally leaves people feeling full and satisfied. Less hungry means people will actually remain on the diet longer while consuming fewer calories. Keto and eyesight. Diabetics are aware that high blood sugar can lead to a higher risk of developing cataracts. Since the keto diet controls sugar levels, it can help retain eyesight and help prevent cataracts. This has been proven in several studies involving diabetic patients. Keto and autism. We know the keto diet affects brain functions. In a study on autism, it was found that it also has a positive effect on autism. 30 autistic children were placed on the keto diet. All showed improved in autistic behavior, especially those on the milder autistic spectrum. While more studies are needed, the results were extremely positive. In this video, we'll talk about the keto diet and cancer. Cancer has turned into a serious disease in our modern society. While cancer was not a large factor before the 20th century, it did exist, of course. Our modern diet and sedentary lifestyle have made cancer the second primary cause of death, with 1,600 Americans dying from this disease every day. It appears that our bodies do not react well to being exposed to daily toxins. While any cancer treatment must be guided by your physician, it's a good idea to discuss the keto diet and what it can do to help the treatment of this disease. A cancer-specific keto diet may consist of as much as 90% fat. There's a very good reason for that. What doctors do know is that cancer cells feed off carbohydrates and sugar. That's what helps them grow and multiply in number. As we've seen, the keto diet dramatically reduces our carbohydrate and sugar consumption as our metabolism is altered. What the keto diet does, in essence, is remove the food on which the cancer cells feed and starves them. The result is that the cancer cells may die, multiply at a slower rate, or decrease. Another reason why a keto diet is able to slow down the growth of cancer cells is that by reducing calories, cancer cells have less energy to develop and grow in the first place. Insulin also helps cells grow. Since the keto diet lowers insulin levels, it slows down the growth of tumorous cells. When on the keto diet, the body produces ketones. While the body is fueled by ketones, cancerous cells are not. Therefore, a state of ketosis may help reduce the size and growth of cancer cells. One study monitored the growth of tumors in patients suffering from cancer of the digestive tract. Of those patients who received a high carbohydrate diet, tumors showed a 32.2% in growth. Patients on a keto diet showed a 24.3% growth in their tumor. The difference is quite significant. Another study involved 5 patients who combined chemotherapy with a keto diet. 3 of these patients went into remission. 2 patients showed a progression of the disease when they went off the keto diet. More studies are needed, but these numbers are encouraging. The keto diet may help prevent cancer from occurring in diabetic patients in the first place. People with diabetes have a higher risk level to develop cancer due to elevated blood sugar levels. Since the ketogenic diet is extremely effective at decreasing the levels of blood sugar, it may prevent the initial onset of cancer. From what research has discovered so far, the ketogenic diet may stop the growth of cancer cells, help replace cancerous cells with healthy cells, change the body's metabolism, and enable the body to starve cancer cells by depriving them of needed nutrition. By lowering the body's insulin level, the ketogenic body may prevent the onset of cancer cells. On a ketogenic diet, specifically for cancer, your fat should be at 75 to 90%, protein 15 to 20%, and less than 5% carbohydrates. Foods to eat: eggs, including yolks, all green leafy vegetables, as well as cauliflower, avocado, mushrooms, peppers, cucumbers, and tomatoes. When choosing dairy, opt for a full-fat version of cheeses, butter, sour cream, yogurt, and milk. Eat nuts such as walnuts, almonds, filberts, and sunflower and pumpkin seeds. Foods to eat in moderation: have 1 helping of root vegetables, such as yams, parsnips, carrots, and turnips every day. Fruits contain sugar, so treat them like candy, 1 small piece per day. A glass of wine, vodka, whiskey, and brandy once a week. No cocktails with sugars. A small piece of chocolate with 75% or higher cocoa content once a week. Foods to avoid: any food containing sugar, including cereals, soft drinks, juices and sports drinks, candies and chocolate. Limit artificial sweeteners as much as possible. Starchy foods such as pasta and potatoes, breads, potato chips and French fries, cooking oils and margarine. All beers. In this video, we'll talk about the keto diet and epilepsy. The initial use of the keto diet has nothing to do with weight loss or diabetes management, for which it is now so well known. Instead, the diet was created by a doctor in 1924 to help his patients suffering from epilepsy. Epilepsy is a nervous system disorder that can bring on recurrent seizures at any time. The symptoms can be spasms and convulsions or an unusual psychological view of the world. In any case, it's caused by abnormal brain activity. The severity of the symptoms varies from person to person, but a person is diagnosed with epilepsy if he or she suffers from more than 2 seizures in 1 full day. Anyone can suffer from this disorder, but it seems to affect young children the most, perhaps because the young brain is still in a state of development. Seizures are frequently managed by drugs. Sometimes they work, sometimes they don't. As far back as 1924, however, Dr. Russell Wilder of the Mayo Clinic conducted groundbreaking research and created the ketogenic diet to help children suffering from epilepsy. It was remarkably effective, but doctors lost interest when the new anti-seizure medications came on the market. It was easier for them to prescribe medication than to discuss diet. However, people who used the keto diet to treat seizures continued seeing remarkable success. Today, doctors are returning to using low-carbohydrate, high-fat diets to treat their patients. The results have been extremely promising. In 1998, the Journal of Pediatrics published a study involving 150 children who experienced seizures despite taking popular anti-seizure medications. The children were placed on the ketogenic diet for 1 year, which the researchers assessed their progress. 83% of the subjects were still in the study after 3 months. Over 1/3 of the children showed a 90% decrease in seizures. At the end of the year, slightly more than half of the subjects had remained on the diet, and 1/4 of them experienced a 90% decrease in seizures. The numbers indicate that the keto diet has a tremendously positive effect on children who suffer from seizures. The researchers consider it more effective than medication in many cases. For anyone with children who experience seizures, the inclusion of a keto diet in the child's treatment should be discussed with his or her physician. Another research on the effects of the keto diet on childhood epilepsy involved 145 children. The children were divided into 2 groups, with one group being treated with medication while the other group received a ketogenic diet. 74% of the ketogenic diet group were successful in reducing seizures. There have been more studies of childhood epilepsy and the keto diet. These have sparked new and considerable interest within the medical profession.